Ren 13 is 5 cm superior to the centre of the umbilicus, on the midline. Ren 14 is 6 cm superior to the centre of the umbilicus, on the midline. Ren 15 is 7 cm superior to the centre of the umbilicus, on the midline. Ren 16 is on the midline at the diffie-sternal junction. Ren 17 is on the anterior midline, level with the fourth intercostal space. Liver 14 is 4 cm lateral to the midline in the sixth intercostal space. When you locate this point, make sure you are in the intercostal space, not on the rib. Liver 13 is located just anterior and inferior to the free end of the 11th rib. To locate the free end of the 11th rib, palpate up the lower margin of the rib cage till you get to the first free floating rib, which is the 11th. This point is never inferior to the umbilicus and never posterior to the mid-axillary line. Gallbladder 24 is 4 cm lateral to the midline in the seventh intercostal space. When you palpate this point, make sure that you are in the intercostal space, not on the rib. Stomach 25 is 2 cm lateral to the midline at the centre of the umbilicus.
Gallbladder 15 is located at the midpoint between DO 24 and stomach 8. It's half a cm into the anterior hairline. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Bladder 10 is located 1.3 cm lateral to DO 15. It's 4.5 cm from DO 15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle.
Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpal radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpal radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again.
Large intestine 7 is located 5 supraproximal on a line joining large intestine 5 and large intestine 11. The point has quite a bony feel. Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Stomach 45 is the lateral nail point of the second toe. Be sure to mark this point clear of the nail bed and in the flare of the base of the distal phalange. Spleen 2 is located in a depression which is distal and inferior to the first metatarsophalangeal joint. See the knuckle of the big toe, come distal and inferior and tuck your point into the flesh at the flare of the base of the proximal phalange.